Dr. Carlos Clark, MD here. Thanks for tuning back in. Today we want to talk about metabolic syndrome. Wow, it sounds like something kind of rare, obscure, something we'll probably never have to deal with, right? Well, think again. Tell me this. Have you been kind of getting on up there in age? Has your waistline started to, expand a little bit? Starting having trouble with blood sugars, blood pressure? Yeah, you know who you are. Has this guy showed up in your family photos? Anyway, we're about to talk about metabolic syndrome today, so stay tuned. Dr. Carlos Clark here again. Thank you for joining us one more time. This is my friend, colleague, and my own personal physician, and she also has a certification in obesity medicine, Dr. Leah McKnight Haas DO. She's here to talk with us a little bit about metabolic syndrome, some of the criteria.
So metabolic syndrome is basically a conglomerate of different conditions to make one syndrome.
Right.
So the way that I like to explain it best to my patients, which I think is probably the simplest way to do it, is with this little diagram right here that looks kind of like a tree. If you can use your imagination and see a tree here, you can see that the majority of the criteria are things that most Americans have at least one of, or maybe multiple of these things. But increased waist circumference. This does differ from men to women. So it's women with a waist circumference greater than 40 inches and men with a waist circumference greater than 50 inches. Increased blood sugar, that's anything greater than 100, or an A1C greater than 5.6, and an HbA1C, just for our listening audience, is how an average of your blood sugar over 3 months.
3 month average, right?
Yeah, so a 3 month average. So also your HDL, if it's low, less than 40 in men and less than 50 in women.
And that's the good cholesterol, right?
Yeah, that's your good cholesterol. That's what helps protect us from heart disease and stroke. That is, that's another diagnostic criteria. If your triglycerides are greater than 150, that's also a criteria. And if your blood pressure is greater than 130/85. So, and that doesn't matter even if you're treated. So a lot of people are on blood pressure medicine, but their blood pressure is less than 130/85. That doesn't matter. The fact is that you're still on blood pressure medicine to control it. So if
you're treated for any of these things, then it's normal. It still counts.
It still counts.
Gotcha.
If you're taking medicine for any of these conditions, it still counts. So, one thing that we as physicians a lot of times get caught up doing is we have medicine to treat just your waist circumference, to help you lose weight. We have medicine to help blood sugar and your cholesterol and your blood pressure. But we fail to kind of say and actually use the terminology metabolic syndrome for our patients a lot of times, because it's just, we just know that there's these medicines and that's how we're going to do it. But ultimately, what I think is really important, the take-home message when we start talking about metabolic syndrome in general, is what makes this tree grow.
Right.
So what makes this tree grow is actually increased levels of insulin.
Right.
Insulin is a hormone, and I can't write from this direction, but so it's increased levels of insulin, and as the insulin levels rise in the body, we start seeing these changes happen.
Right.
A lot of times, before we even see changes in blood sugar, we'll start seeing changes in triglycerides. Right. So the biggest thing to do is not take medicine for all these different conditions, but rather just chop down the tree.
Right.
So that's kind of my take on metabolic syndrome.
All right. So you know what? Honestly, all this makes sense, and really all these things feed on each other, because I know as your triglycerides get higher, you become more insulin resistant. So the insulin's going up, and you become more insulin resistant. So they kind of feed off each other on like an exponential type of rate.
So because and what you see, like if you notice, just in that, and tell patients this too, when you see patients who have really skinny legs and big bellies,
right?
I mean, a lot of times they're diabetic patients, or they have sugar problems, because high insulin levels make us retain abdominal fat,
right?
And that is actually the most metabolically active fat in the body, as well as causing more hormone problems than other types of fat. But the biggest goal is trying to get your insulin down. So if we can actually chop down the tree, for lack of a better way to say it, by decreasing your insulin levels, then maybe we can avoid 5 different medicines.
Right.
And obviously, anytime that you can get off medicines, that's one of my favorite things to do as a physician, is to stop medicines. Right. then that's good.
So how do we attack it from like the tree trunk area? I know, we can have all these different items that we're treated for, but how's the best way to attack it? Obviously diet's,
diet is going to be the most important thing.
Right.
But obviously, I think, finding a trend too is important because you may not, the first time you go have your lab work done with your physician, you may not have all, 3 of these, 5 diagnostic criteria.
Yeah.
But over time, you can start to see these changes and addressing it as soon as possible. The biggest thing that you could do dietary wise is reducing your carbohydrate intake. Carbohydrates are the things that are broken down into sugar. It's what makes our insulin high just from dietary changes.
Right.
So the average American consumes about 300 carbs a day. I recommend, actually a low carbohydrate diet is considered less than 120 carbs a day.
Right.
Obviously, if we're really getting aggressive, maybe a little bit lower than that.
I guess some of the processed type of carbs are probably a little worse than
absolutely.
Right. Yeah.
I really hate telling anybody to not eat carbohydrates because I think fruits have a bad rap.
It's what our body lives off of, right?
Fruit has a bad rap, but the reality is that kind of carbohydrate is attached to a lot of antioxidants and a lot of vital nutrients that we need to do all of our metabolic processes in the body.
Right.
So I really hate saying,
don't eat the natural
fruit,
stuff.
Don't
right,
eat.
right.
I like to say, if God made it, it's
Absolutely,
good for you.
Absolutely.
So He didn't make any mistakes.
Right.
It's the things that come in the bags and from
Absolutely.
factories that are getting us in trouble.
Yeah, I just want our patients, to realize the difference between the two, because ultimately our bodies do live off of carbohydrates.
That's right.
I mean that's what we use for fuel, but not in the form of of Little Debbie cakes and things like that.
Saltine
right?
crackers there's just the more processed foods that we can eliminate, no doubt the better for our bodies overall. And I could go into whole spill about that. It has nothing to do with metabolic syndrome, but it is imperative in metabolic syndrome that we really start addressing processed foods in general, because they're laden with carbohydrates and hidden sugars, because that's the way that our food industry is making food cheaper and more affordable for people.
Absolutely.
So I do think that that's extremely important. Another thing that I'd like to encourage my patients to do to increase insulin sensitivity, so to help their bodies use the insulin it has, is exercise.
Absolutely.
Because that increases your insulin receptors on your muscles. So if you're exercising, then you're also going to improve your body's ability to use what it has. That's one of the craziest things to me about diabetes that we do is we treat a problem that starts with high insulin level with insulin.
Right.
And we're constantly chasing our tail.
Right.
But again, that's a little bit more complex. But increasing the physical activity is important. Obviously, medicines that we can do to try to decrease any of those conditions to optimize would be beneficial. But the majority of it has everything to do with diet.
Absolutely. And it's tough in this day and age. It's tough to find time to exercise, and things just compound on each other. And it's easy to say, hey, just burn more calories than you take in, which will work. But I think diet and eating is a lot more complex than that. And
just to add on to what you're saying about if you calorically restrict, like if you calorically restrict, yes, you're going to lose weight initially, but the maintenance of that has been it's terrible. It's the data doesn't suggest that it works long term. So that's how come changing what you're eating is the most important.
Absolutely.
So I think I had this conversation just the other day with a patient and another colleague was, we're not getting healthier. There's nothing about our world, like the United States, we're not getting healthier. We're actually getting sicker. What are we doing? Because our medicine is better than it ever has been. Our technology is better than it ever has been. But we continue to get sick. And it has everything to do with diet.
That's what you put in your mouth. Absolutely.
And I say this and my patients really get tired of me saying this because I love Cheez-Its. I mean, I do. Let's just face it. Like, if I have a weakness, it's probably a Cheez-It. But if I am constantly worried about what that Cheez-It is doing to my body, then I probably am not going to eat it, so I don't eat it.
Right.
You know what I mean? If it is, it's a very rare thing. But, what happens is I have these patients who don't want to take a statin because their cholesterol's high and they heard these terrible things about a statin that's going to cause this, you know, it's going to cause a myalgia, it's going to make my liver, you know, enzymes go high or whatever. But I'm like, but if we were thinking about what those Cheez-Its were doing to your body to begin with, we wouldn't be having a conversation about the side effect of medication.
Yeah, absolutely.
And I think that is an important conversation to have with our patients, that every single thing that you put in your body has a side effect.
Yeah, absolutely.
So it doesn't matter if it's food, if it's medicine, it all has a side effect. And there's no way that you can put something in that doesn't have an effect.
Absolutely.
We just want to make sure that the effects are good effects, you know, things that are healing and nurturing. So God made it.
Absolutely.
Eat it. That's that's the take home message, I think.
And I've personally never been a proponent to give a pill to reduce appetite. Now there are some very rare cases that I'll do it, but for those who struggle from, you know, the mental portion of cravings and things like that, is there some pretty good things out there on the market now for that, just to get somebody kick-started?
Yeah, there's not a lot of medication options for obesity, trying to get people jump-started. There is a true, you know, there is true chemical imbalance in the brain that can happen, and there are some newer drugs out there to try to target those things with cravings and like a food addiction, for lack of a better way to say it. Even some new medications for binge eating disorder. So those are things that definitely, you know, there are options out there to try to get you started. It's not a fix-all by any means. There is no medication that is a fix-all for any problem. Don't care what problem we're talking about. But it can at least get you started in the right direction, and it could be a very helpful tool. In the long run.
Absolutely. Well, as always, again, the legal stuff. Check with your personal physician. This is just informational purposes only. But, you know, this is very interesting. It's something that we deal with every day. I mean, this isn't some, you know, like I said in the intro, this isn't some rare, you know, type of disease. This is very common. This is part of life. And it, you know, you don't really realize it's on you until you start having these comorbidities. So if you can, try to chop down the tree, patients. So thanks a lot for joining. Thanks for subscribing. Please leave comments in the section below. If you have any suggestions, questions, I'll try my best to get to them. You know, if you have any topics that you want us to address, please, you know, submit. I'll try my best to get to it. So thanks again for joining, and we'll see you on the next one.